Infection is the invasion of an organism's body tissues by disease-causing agents, their multiplication, and the reaction of host tissues to the infectious agents and the toxins they produce. Infectious disease, also known as transmissible disease or communicable disease, is illness resulting from an infection. Infections are caused by infectious agents including viruses, viroids, prions, bacteria, nematodes such as parasitic roundworms and pinworms, arthropods such as ticks, mites, fleas, and lice, fungi such as ringworm, and other macroparasites such as tapeworms and other helminths. Hosts can fight infections using their immune system. Mammalian hosts react to infections with an innate response, often involving inflammation, followed by an adaptive response. Specific medications used to treat infections include antibiotics, antivirals, antifungals, antiprotozoals, and antihelminthics. Infectious diseases resulted in 9.2 million deaths in 2013, about 17% of all deaths. The branch of medicine that focuses on infections is referred to as infectious disease. Classification: subclinical versus clinical, latent versus apparent. Symptomatic infections are apparent and clinical, whereas an infection that is active but does not produce noticeable symptoms may be called inapparent, silent, subclinical, or occult. An infection that is inactive or dormant is called a latent infection. An example of a latent bacterial infection is latent tuberculosis. Some viral infections can also be latent. Examples of latent viral infections are any of those from the herpes viridae family. The word infection can denote any presence of a particular pathogen at all, no matter how little, but also is often used in a sense implying a clinically apparent infection, in other words, a case of infectious disease. This fact occasionally creates some ambiguity or prompts some usage discussion. To get around the usage annoyance, it is common for health professionals to speak of colonization, rather than infection, when they mean that some of the pathogens are present but that no clinically apparent infection, no disease, is present. A short-term infection is an acute infection. A long-term infection is a chronic infection. Infections can be further classified by causative agent, bacterial, viral, fungal, parasitic, and by the presence or absence of systemic symptoms, sepsis. Primary versus opportunistic. Among the many varieties of microorganisms, relatively few cause disease in otherwise healthy individuals. Infectious disease results from the interplay between those few pathogens and the defenses of the hosts they infect. The appearance and severity of disease resulting from any pathogen depends upon the ability of that pathogen to damage the host as well as the ability of the host to resist the pathogen. However, a host's immune system can also cause damage to the host itself in an attempt to control the infection. Clinicians therefore classify infectious microorganisms or microbes according to the status of host defenses, either as primary pathogens or as opportunistic pathogens. Primary pathogens. Primary pathogens cause disease as a result of their presence or activity within the normal, healthy host, and their intrinsic virulence. The severity of the disease they cause is, in part, a necessary consequence of their need to reproduce and spread. Many of the most common primary pathogens of humans only infect humans. However, many serious diseases are caused by organisms acquired from the environment or that infect non-human hosts. Opportunistic pathogens. Opportunistic pathogens can cause an infectious disease in a host with depressed resistance, immunodeficiency, or if they have unusual access to the inside of the body, for example, via trauma. Opportunistic infection may be caused by microbes ordinarily in contact with the host, such as pathogenic bacteria or fungi in the gastrointestinal or the upper respiratory tract, and they may also result from, otherwise innocuous, microbes acquired from other hosts, as in Clostridium difficile colitis, or from the environment as a result of traumatic introduction, as in surgical wound infections or compound fractures. An opportunistic disease requires impairment of host defenses, which may occur as a result of genetic defects, such as chronic granulomatous disease, exposure to antimicrobial drugs or immunosuppressive chemicals, as might occur following poisoning or cancer chemotherapy, exposure to ionizing radiation, or as a result of an infectious disease with immunosuppressive activity, such as with measles, malaria, or HIV disease. Primary pathogens may also cause more severe disease in a host with depressed resistance than would normally occur in an immunosufficient host. Primary infection versus secondary infection. A primary infection is infection that is, or can practically be viewed as, the root cause of the current health problem. In contrast, a secondary infection is a sequela or complication of a root cause. For example, pulmonary tuberculosis is often a primary infection, but an infection that happened only because a burn or penetrating trauma, the root cause, allowed unusual access to deep tissues is a secondary infection. Primary pathogens often cause primary infection and also often cause secondary infection. Usually opportunistic infections are viewed as secondary infections, because immunodeficiency or injury was the predisposing factor. Infectious or not. One way of proving that a given disease is infectious, is to satisfy Koch's postulates, first proposed by Robert Koch, which demands that the infectious agent be identified only in patients and not in healthy controls, and that patients who contract the agent also develop the disease. These postulates were first used in the discovery that Mycobacteria species cause tuberculosis. Koch's postulates cannot be applied ethically for many human diseases because they require experimental infection of a healthy individual with a pathogen produced as a pure culture. Often, even clearly infectious diseases do not meet the infectious criteria. For example, Treponema pallidum, the causative spirochete of syphilis, cannot be cultured in vitro. However, the organism can be cultured in rabbit testes. It is less clear that a pure culture comes from an animal source serving as host than it is when derived from microbes derived from plate culture. Epidemiology is another important tool used to study disease in a population. For infectious diseases, it helps to determine if a disease outbreak is sporadic, occasional occurrence, endemic, regular cases often occurring in a region, epidemic, an unusually high number of cases in a region, or pandemic, a global epidemic. Contagiousness. Infectious diseases are sometimes called contagious disease when they are easily transmitted by contact with an ill person or their secretions, e.g., influenza. Thus, a contagious disease is a subset of infectious disease that is especially infective or easily transmitted. Other types of infectious/transmissible/communicable diseases with more specialized routes of infection, such as vector transmission or sexual transmission, are usually not regarded as contagious, and often do not require medical isolation, sometimes loosely called quarantine, of victims. However, this specialized connotation of the word contagious and contagious disease, easy transmissibility, is not always respected in popular use. Infectious diseases are commonly transmitted from person to person through direct contact. The types of contact are through person to person and droplet spread. Indirect contacts such as airborne transmission, contaminated objects, food and drinking water, animal-person contact, animal reservoirs, insect bites, and environmental reservoirs are another way infectious diseases are transmitted. By anatomic location. Infections can be classified by the anatomic location or organ system infected, including urinary tract infection, skin infection, respiratory tract infection, odontogenic infection, an infection that originates within a tooth or in the closely surrounding tissues. Vaginal infections. Intraamniotic infection. In addition, locations of inflammation where infection is the most common cause include pneumonia, meningitis, and salpingitis. Signs and symptoms. The symptoms of an infection depend on the type of disease. Some signs of infection affect the whole body generally, such as fatigue, loss of appetite, weight loss, fevers, night sweats, chills, aches and pains. Others are specific to individual body parts, such as skin rashes, coughing, or a runny nose. In certain cases, infectious diseases may be asymptomatic for much or even all of their course in a given host. In the latter case, the disease may only be defined as a disease, which by definition means an illness, in hosts who secondarily become ill after contact with an asymptomatic carrier. An infection is not synonymous with an infectious disease, as some infections do not cause illness in a host. Bacterial or viral. Bacterial and viral infections can both cause the same kinds of symptoms. It can be difficult to distinguish which is the cause of a specific infection. It's important to distinguish, because viral infections cannot be cured by antibiotics. Comparison of viral and bacterial infection. Viral infection. Typical symptoms in general, viral infections are systemic. This means they involve many different parts of the body or more than one body system at the same time, i.e. a runny nose, sinus congestion, cough, body aches etc. They can be local at times as in viral conjunctivitis or pink eye and herpes. Only a few viral infections are painful, like herpes. The pain of viral infections is often described as itchy or burning. Cause. Pathogenic viruses. Bacterial infection. Typical symptoms. The classic symptoms of a bacterial infection are localized redness, heat, swelling and pain. One of the hallmarks of a bacterial infection is local pain, pain that is in a specific part of the body. For example, if a cut occurs and is infected with bacteria, pain occurs at the site of the infection. Bacterial throat pain is often characterized by more pain on one side of the throat. An ear infection is more likely to be diagnosed as bacterial if the pain occurs in only one ear. A cut that produces pus and milky-colored liquid is most likely infected. Cause. Pathogenic bacteria. Pathophysiology. There is a general chain of events that applies to infections. The chain of events involves several steps which include the infectious agent, reservoir, entering a susceptible host, exit, and transmission to new hosts. Each of the links must be present in a chronological order for an infection to develop. Understanding these steps helps healthcare workers target the infection and prevent it from occurring in the first place. Colonization. Infection begins when an organism successfully enters the body, grows and multiplies. This is referred to as colonization. Most humans are not easily infected. Those who are weak, sick, malnourished, have cancer or are diabetic have increased susceptibility to chronic or persistent infections. Individuals who have a suppressed immune system are particularly susceptible to opportunistic infections. Entrance to the host at host pathogen interface generally occurs through the mucosa in orifices like the oral cavity, nose, eyes, genitalia, anus, or the microbe can enter through open wounds. While a few organisms can grow at the initial site of entry, many migrate and cause systemic infection in different organs. Some pathogens grow within the host cells, intracellular, whereas others grow freely in bodily fluids. Wound colonization refers to non-replicating microorganisms within the wound, while in infected wounds, replicating organisms exist and tissue is injured. All multicellular organisms are colonized to some degree by extrinsic organisms, and the vast majority of these exist in either a mutualistic or commensal relationship with the host. An example of the former is the anaerobic bacteria species, which colonizes the mammalian colon, and an example of the latter is various species of Staphylococcus that exist on human skin. Neither of these colonizations are considered infections. The difference between an infection and a colonization is often only a matter of circumstance. Non-pathogenic organisms can become pathogenic given specific conditions, and even the most virulent organism requires certain circumstances to cause a compromising infection. Some colonizing bacteria, such as Corynebacteria sp and Viridans streptococci, prevent the adhesion and colonization of pathogenic bacteria and thus have a symbiotic relationship with the host, preventing infection and speeding wound healing. The variables involved in the outcome of a host becoming inoculated by a pathogen and the ultimate outcome include the route of entry of the pathogen and the access to host regions that it gains, the intrinsic virulence of the particular organism, the quantity or load of the initial inoculant, the immune status of the host being colonized. As an example, several staphylococcal species remain harmless on the skin, but, when present in a normally sterile space, such as in the capsule of a joint or the peritoneum, multiply without resistance and cause harm. An interesting fact that gas chromatography, mass spectrometry, 16S ribosomal RNA analysis, omics, and other advanced technologies have made more apparent to humans in recent decades is that microbial colonization is very common even in environments that humans think of as being nearly sterile. Because it is normal to have bacterial colonization, it is difficult to know which chronic wounds can be classified as infected and how much risk of progression exists. Despite the huge number of wounds seen in clinical practice, there are limited quality data for evaluated symptoms and signs. A review of chronic wounds in the Journal of the American Medical Association's Rational Clinical Examination series quantified the importance of increased pain as an indicator of infection. The review showed that the most useful finding is an increase in the level of pain makes infection much more likely, but the absence of pain, negative likelihood ratio range, 0.64–0.88, does not rule out infection. Summary LR 0.64–0.88. Disease. Disease can arise if the host's protective immune mechanisms are compromised and the organism inflicts damage on the host. Microorganisms can cause tissue damage by releasing a variety of toxins or destructive enzymes. For example, Clostridium tetani releases a toxin that paralyzes muscles, and Staphylococcus releases toxins that produce shock and sepsis. Not all infectious agents cause disease in all hosts. For example, less than 5% of individuals infected with polio develop disease. On the other hand, some infectious agents are highly virulent. The prion-causing mad cow disease and Creutzfeldt-Jakob disease invariably kills all animals and people that are infected. Persistent infections occur because the body is unable to clear the organism after the initial infection. Persistent infections are characterized by the continual presence of the infectious organism, often as latent infection with occasional recurrent relapses of active infection. There are some viruses that can maintain a persistent infection by infecting different cells of the body. Some viruses once acquired never leave the body. A typical example is the herpes virus, which tends to hide in nerves and become reactivated when specific circumstances arise. Persistent infections cause millions of deaths globally each year. Chronic infections by parasites account for a high morbidity and mortality in many underdeveloped countries. Transmission. For infecting organisms to survive and repeat the infection cycle in other hosts, they, or their progeny, must leave an existing reservoir and cause infection elsewhere. Infection transmission can take place via many potential routes. Droplet contact, also known as the respiratory route, and the resultant infection can be termed airborne disease. If an infected person coughs or sneezes on another person, the microorganisms, suspended in warm, moist droplets, may enter the body through the nose, mouth, or eye surfaces. Fecal-oral transmission, wherein foodstuffs or water become contaminated, by people not washing their hands before preparing food, or untreated sewage being released into a drinking water supply, and the people who eat and drink them become infected. Common fecal-oral transmitted pathogens include Vibrio cholerae, Giardia species, rotaviruses, Entamoeba histolytica, Escherichia coli, and tapeworms. Most of these pathogens cause gastroenteritis. Sexual transmission, with the resulting disease being called sexually transmitted disease. Oral transmission, diseases that are transmitted primarily by oral means may be caught through direct oral contact such as kissing, or by indirect contact such as by sharing a drinking glass or a cigarette. Transmission by direct contact. Some diseases that are transmissible by direct contact include athlete's foot, impetigo, and warts. Vehicle transmission, transmission by an inanimate reservoir, food, water, soil. Vertical transmission, directly from the mother to an embryo, fetus, or baby during pregnancy or childbirth. It can occur when the mother gets an infection as an intercurrent disease in pregnancy. Iatrogenic transmission, due to medical procedures such as injection or transplantation of infected material. Vector-borne transmission, transmitted by a vector, which is an organism that does not cause disease itself but that transmits infection by conveying pathogens from one host to another. The relationship between virulence versus transmissibility is complex. If a disease is rapidly fatal, the host may die before the microbe can be passed along to another host. Diagnosis. Diagnosis of infectious disease sometimes involves identifying an infectious agent either directly or indirectly. In practice, most minor infectious diseases such as warts, cutaneous abscesses, respiratory system infections and diarrheal diseases are diagnosed by their clinical presentation and treated without knowledge of the specific causative agent. Conclusions about the cause of the disease are based upon the likelihood that a patient came in contact with a particular agent, the presence of a microbe in a community, and other epidemiological considerations. Given sufficient effort, all known infectious agents can be specifically identified. The benefits of identification, however, are often greatly outweighed by the cost, as often there is no specific treatment, the cause is obvious, or the outcome of an infection is benign. Diagnosis of infectious disease is nearly always initiated by medical history and physical examination. More detailed identification techniques involve the culture of infectious agents isolated from a patient. Culture allows identification of infectious organisms by examining their microscopic features, by detecting the presence of substances produced by pathogens, and by directly identifying an organism by its genotype. Other techniques, such as X-rays, CAT scans, PET scans or NMR, are used to produce images of internal abnormalities resulting from the growth of an infectious agent. The images are useful in detection of, for example, a bone abscess or a spongiform encephalopathy produced by a prion. Symptomatic diagnostics. The diagnosis is aided by the presenting symptoms in any individual with an infectious disease, yet it usually needs additional diagnostic techniques to confirm the suspicion. Some signs are specifically characteristic and indicative of a disease and are called pathognomonic signs, but these are rare. Not all infections are symptomatic. In children, the presence of cyanosis, rapid breathing, poor peripheral perfusion, or a petechial rash increases the risk of a serious infection by greater than 5-fold. Other important indicators include parental concern, clinical instinct, and temperature greater than 40 degrees Celsius. Microbial culture. Microbiological culture is a principal tool used to diagnose infectious disease. In a microbial culture, a growth medium is provided for a specific agent. A sample taken from potentially diseased tissue or fluid is then tested for the presence of an infectious agent able to grow within that medium. Most pathogenic bacteria are easily grown on nutrient agar, a form of solid medium that supplies carbohydrates and proteins necessary for growth of a bacterium, along with copious amounts of water. A single bacterium will grow into a visible mound on the surface of the plate called a colony, which may be separated from other colonies or melded together into a lawn. The size, color, shape, and form of a colony is characteristic of the bacterial species, its specific genetic makeup, its strain, and the environment that supports its growth. Other ingredients are often added to the plate to aid in identification. Plates may contain substances that permit the growth of some bacteria and not others, or that change color in response to certain bacteria and not others. Bacteriological plates such as these are commonly used in the clinical identification of infectious bacterium. Microbial culture may also be used in the identification of viruses, the medium in this case being cells grown in culture that the virus can infect, and then alter or kill. In the case of viral identification, a region of dead cells results from viral growth, and is called a plaque. Eukaryotic parasites may also be grown in culture as a means of identifying a particular agent. In the absence of suitable plate culture techniques, some microbes require culture within live animals. Bacteria such as Mycobacterium leprae and Treponema pallidum can be grown in animals, although serological and microscopic techniques make the use of live animals unnecessary. Viruses are also usually identified using alternatives to growth in culture or animals. Some viruses may be grown in embryonate eggs. Another useful identification method is xenodiagnosis, or the use of a vector to support the growth of an infectious agent. Chagas disease is the most significant example, because it is difficult to directly demonstrate the presence of the causative agent, Trypanosoma cruzi, in a patient, which therefore makes it difficult to definitively make a diagnosis. In this case, xenodiagnosis involves the use of the vector of the Chagas agent T. cruzi, an uninfected triatomine bug, which takes a blood meal from a person suspected of having been infected. The bug is later inspected for growth of T. cruzi within its gut. Microscopy. Another principal tool in the diagnosis of infectious disease is microscopy. Virtually all of the culture techniques discussed above rely, at some point, on microscopic examination for definitive identification of the infectious agent. Microscopy may be carried out with simple instruments, such as the compound light microscope, or with instruments as complex as an electron microscope. Samples obtained from patients may be viewed directly under the light microscope, and can often rapidly lead to identification. Microscopy is often also used in conjunction with biochemical staining techniques, and can be made exquisitely specific when used in combination with antibody-based techniques. For example, the use of antibodies made artificially fluorescent, fluorescently labeled antibodies, can be directed to bind to and identify a specific antigens present on a pathogen. A fluorescence microscope is then used to detect fluorescently labeled antibodies bound to internalized antigens within clinical samples or cultured cells. This technique is especially useful in the diagnosis of viral diseases, where the light microscope is incapable of identifying a virus directly. Other microscopic procedures may also aid in identifying infectious agents. Almost all cells readily stain with a number of basic dyes due to the electrostatic attraction between negatively charged cellular molecules and the positive charge on the dye. A cell is normally transparent under a microscope, and using a stain increases the contrast of a cell with its background. Staining a cell with a dye such as Giemsa stain or crystal violet allows a microscopist to describe its size, shape, internal and external components and its associations with other cells. The response of bacteria to different staining procedures is used in the taxonomic classification of microbes as well. Two methods, the Gram stain and the acid-fast stain, are the standard approaches used to classify bacteria and to diagnosis of disease. The Gram stain identifies the bacterial groups Firmicutes and Actinobacteria, both of which contain many significant human pathogens. The acid-fast staining procedure identifies the actinobacterial genera Mycobacterium and Nocardia. Biochemical tests. Biochemical tests used in the identification of infectious agents include the detection of metabolic or enzymatic products characteristic of a particular infectious agent. Since bacteria ferment carbohydrates in patterns characteristic of their genus and species, the detection of fermentation products is commonly used in bacterial identification. Acids, alcohols, and gases are usually detected in these tests when bacteria are grown in selective liquid or solid media. The isolation of enzymes from infected tissue can also provide the basis of a biochemical diagnosis of an infectious disease. For example, humans can make neither RNA replicases nor reverse transcriptase, and the presence of these enzymes are characteristic of specific types of viral infections. The ability of the viral protein hemagglutinin to bind red blood cells together into a detectable matrix may also be characterized as a biochemical test for viral infection, although strictly speaking hemagglutinin is not an enzyme and has no metabolic function. Serological methods are highly sensitive, specific, and often extremely rapid tests used to identify microorganisms. These tests are based upon the ability of an antibody to bind specifically to an antigen. The antigen, usually a protein or carbohydrate made by an infectious agent, is bound by the antibody. This binding then sets off a chain of events that can be visibly obvious in various ways, dependent upon the test. For example, strep throat is often diagnosed within minutes, and is based on the appearance of antigens made by the causative agent, S. pyogenes, that is retrieved from a patient's throat with a cotton swab. Serological tests, if available, are usually the preferred route of identification. However, the tests are costly to develop and the reagents used in the test often require refrigeration. Some serological methods are extremely costly, although when commonly used, such as with the strep test, they can be inexpensive. Complex serological techniques have been developed into what are known as immunoassays. Immunoassays can use the basic antibody-antigen binding as the basis to produce an electromagnetic or particle radiation signal, which can be detected by some form of instrumentation. Signal of unknowns can be compared to that of standards allowing quantitation of the target antigen. To aid in the diagnosis of infectious diseases, immunoassays can detect or measure antigens from either infectious agents or proteins generated by an infected organism in response to a foreign agent. For example, immunoassay A may detect the presence of a surface protein from a virus particle. Immunoassay B, on the other hand, may detect or measure antibodies produced by an organism's immune system that are made to neutralize and allow the destruction of the virus. Instrumentation can be used to read extremely small signals created by secondary reactions linked to the antibody-antigen binding. Instrumentation can control sampling, reagent use, reaction times, signal detection, calculation of results, and data management to yield a cost-effective automated process for diagnosis of infectious disease. Pcr Based Diagnostics. Technologies based upon the polymerase chain reaction, PCR, method will become nearly ubiquitous gold standards of diagnostics of the near future, for several reasons. First, the catalog of infectious agents has grown to the point that virtually all of the significant infectious agents of the human population have been identified. Second, an infectious agent must grow within the human body to cause disease. Essentially, it must amplify its own nucleic acids in order to cause a disease. This amplification of nucleic acid in infected tissue offers an opportunity to detect the infectious agent by using PCR. Third, the essential tools for directing PCR, primers, are derived from the genomes of infectious agents, and with time those genomes will be known, if they are not already. Thus, the technological ability to detect any infectious agent rapidly and specifically are currently available. The only remaining blockades to the use of PCR as a standard tool of diagnosis are in its cost and application, neither of which is insurmountable. The diagnosis of a few diseases will not benefit from the development of PCR methods, such as some of the clostridial diseases, tetanus and botulism. These diseases are fundamentally biological poisonings by relatively small numbers of infectious bacteria that produce extremely potent neurotoxins. A significant proliferation of the infectious agent does not occur. This limits the ability of PCR to.
Please subscribe and thanks for watching.